Hi everyone. So the patient I chose for this week, I chose because we diagnosed her potentially with hyperthyroidism, and I just found that interesting because we see so many patients with hypothyroidism in our clinics, but very rarely do we see someone with hyperthyroidism. So my patient, AR, is a pleasant 30-year-old Middle Eastern female who presents to the clinic with complaints of palpitations and insomnia. She drove herself to the clinic, is dressed appropriately, and able to answer questions with no difficulty. She appears to be a reliable historian. Her chief complaint is that she's having a hard time sleeping and that she's noticed that she feels like her heart is beating out of her chest and it's fast. So she HPI. AR is a pleasant 30-year-old Middle Eastern woman who presents to the clinic with complaints of palpitations and insomnia. She states that she has a fast heart rate and palpitations, feeling that it's coming out of her chest. She noticed the palpitations began approximately 3 weeks ago. She denies having any left-sided chest pain or being easily fatigued. She also reports that she's having trouble falling asleep at night. She's tried taking over-the-counter melatonin, 3 milligrams, and has been drinking chamomile tea to help her fall asleep, which hasn't been much help. She also stated that she's been recently agitated and has panic attacks here and there. And she stated that she actually has been eating much more, but I've noticed a significant weight loss as well, even though she has been eating more than usual. She also reports having about 2 to 3 loose stools every day, denies abdominal pain, nausea, vomiting, or fever. She has no history of viral infection or upper respiratory tract infections. She has no other medical health conditions. Her last wellness exam was 5/18/2023. Last pap smear 5/20. No hospitalizations or surgeries in the past. No allergies to food, drugs, or environmental factors. The medications all she's taking is the over-counter melatonin to help her sleep, which hasn't helped. So for review of systems, patient states she has lost approximately 15 pounds in the past 3 weeks. She states that there has not been any changes to her diet. In fact, she has been eating more than usual. Denies any added physical activity. States that she doesn't have time since she does have 2 young children. Patient denies night sweats, chills, or high levels of fatigue. Denies any recent nasal discharge, no dysphagia, epistaxis, or blurred vision. No complaints of wheezing, chest pain, coughing, or shortness of breath. She is complaining of rapid heart rate and palpitations, but no edema. Denies nausea, diarrhea, vomiting, constipation, and no dysuria, frequency hematuria. No muscle, joint pain, no stiffness, no vertigo, headache, vision changes, or seizures. For her vital signs, her heart rate was elevated at 114 beats per minute. Her blood pressure was also slightly elevated, 152/84. Temperature 98.7. Respiratory rate 18. Her O2 stat was 98% at room air. She is 5'7" tall, weighs 125.6 pounds, making her BMI 19.7. On physical exam, we saw the patient is alert, oriented to time, place, and people. Her eyes are equal, responsive to lights, perla, no lesions, bumps, or bruises on her head. We palpated her thyroid gland as she swallowed. There wasn't any swelling. It was non-tender. No wheezes, rales, or rhonchi upon auscultation to her lungs. For her heart rate, we did notice tachycardia, but S1 and S2 were present, so there were no murmurs noted. Her abdomen was positive for bowel sounds, normal, active, soft, non-distended, non-tender. Her cranial nerves were intact, 1 to 12. She's able to move all her extremities. Grip strength was 5 out of 5 bilaterally, and lower and upper extremity strength were 5 out of 5 bilaterally. Her skin was dry, warm to touch, and we noted that her hands did have little tremors when she extended them out, and she did have sweaty palms. But no joint pain or joint swelling, no limited range of motion in any of her extremities. So my differential diagnoses for her were subacute thyroiditis. This one I ended up not choosing because you usually need a prior viral infection, and it usually includes a tender enlarged thyroid gland and a tender cervical lymphadenopathy, which she did not have. So did not go with that. Another differential diagnosis was an anxiety disorder. Although she does have anxiety, and this could be a possibility, it doesn't explain all the other symptoms she has with the tremors, tachycardia. And the last one is pheochromocytoma. This would only account for her tachycardia, the increased blood pressure, and the palpitations, but not any of the other symptoms that she's manifesting. So my main diagnosis is hyperthyroidism, and just given the patient's medical history and physical examination, that's what I would go with. Graves' disease is most likely the cause, and we would go with hyperthyroidism because of the palpitations, the weight loss, tremors, diarrhea, and the sweaty palms. The plan is to get a lab work done, so a thyroid function test. It's test for TSH, T3, and T4, and once the labs have confirmed a diagnosis, once we get the lab work back and we get a diagnosis, we can begin her on methimazole 10 milligrams POTID. So patient education, just making sure she's exercising regularly, practicing relaxation techniques, decreasing the amount of iodine in her diet. We're going to follow up with the patient once the lab results are in to review with them. Once she starts on the medication, we're going to follow up in 6 weeks to assess the effectiveness and to see if we need to change the dosage, and just letting the patient know if things worsen to go to the ER or give us a call. Thank you.